Okay, so this is my project PowerPoint on dislocated shoulders by me, Keaton Vayette. Oh. Okay, so some of the bones affected by this injury. Shoulder dislocation occurs when the head of the upper arm, the humerus, comes out of its socket, which I'm going to be showing here. Which I have the humerus and I have the glenoid, which is the socket in here that you can hear. So the humerus consists of the bones, a large rounded head, and the neck, which connects to the body. And then the glenoid is a shallow cavity, which is located on the lateral angle of the scapula, shoulder blade. And then this is the glenoid, which you can hear. It's the little socket. So the muscles, ligaments, and tendons affected by this injury. The main one, or the main structure that is affected, is the labrum, which tears when you dislocate your shoulder, which is called the Bankart lesion. Which, as you can see, when you when you tear it, labrum on the side or on the side rips, and then you have Bankart lesion. So the labrum is a piece of fibrocartilage, a rubbery tissue, attached to the rim of the glenoid, and there that helps keep the ball and joint in place so it's stable. And then that's where the anterior inferior glenohumeral ligament attaches. That's inside as well. And then that also stabilizes the shoulder and prevents it from dislocating anteriorly. Keeps it stable. And when the head of the humerus dislocates, it impacts the glenoid, creating a divot. So when you dislocate it, pops out, and then this end of the glenoid keeps hitting the head of the humerus and creates a divot, which makes some surgeries difficult. And then to cause this injury, there are many different ways, but most common are a sharp twisting motion in an overhead position, or falling onto your shoulder, especially on a hard surface like a cord or ground or ice, being hit in the shoulder directly, or trying to break your fall with your hands, which also leads to broken wrists sometimes. So some common examples are getting hit in the boards on hockey, going up to block someone in basketball, or falling onto your shoulder or hands in soccer. So some of the complications for this injury are auxiliary nerve or artery damage. Should be seen here is where it is. Tearing of the rotator cuff muscles or tendons leading to weakness in the shoulder and body. Then also recurrent shoulder instability if you have a severe dislocation, or if your tissues have not fully healed, you're more and almost guaranteed to redislocate. And then from personal experience, I've seen many kids go back way too early to their sport, especially hockey, and listen to their coach, but then weeks later, another dislocation, and they're out for the season. So recovery time. It depends on your body and how serious your injury is, but it takes up to 12 to 16 weeks to completely recover from a dislocated shoulder. Doctors recommend that you keep your sling on for 3 weeks after dislocation with minimal movement. And then you can usually resume most daily activities within 6 weeks, but avoid the gym and heavy lifting, and also playing contact sports involving shoulder movements for 3 months. And like I said before, if you decide to go back before, you are pretty much guaranteed to redislocate. Then some recommended exercises for this recovery are when you beginning after you are somewhat recovered. You should start with static isometric exercises involving no movement to the shoulder. So just your arm and trying to strengthen and unstiffen your shoulder after its long recovery. So some examples are external rotation, where she's moving out, internal in, flexion up and away. And then it's important for athletes to avoid any movement which abduct and laterally rotate your shoulder in the early stages, as this position is the most likely to dislocate again with abduct. You can't see, but abduct and externally rotate, or your shoulder could pop out again. Then a strengthening program for an anterior dislocated shoulder can begin as pain allows it. So if you can handle the pain, or if there is no pain, then you're good to begin your program. So that is the end. Here's my work cited. Hope you enjoyed, because I did. I really enjoyed learning about this shoulder injury. Thank you.